So what's the difference between the common cold and the flu? Well, the common cold is often due to a virus called rhinovirus, but a number of other viruses as well can cause a common cold. And the common cold, you get the runny nose, the cough, the aches and pains sometimes, but it tends to be an illness that is a little bit slower in onset and is usually not as severe as influenza. Influenza is due to the influenza viruses. There's a couple of different strains, usually we break it down into strain A or B, and it's a much more rapid onset illness. So usually you might be just starting to feel unwell, but within 24 hours you'll be sort of sick and in bed with the flu. All right? So it's not a disease that hangs on for a few days and then you get sicker. That's normally the cold. But in reality, the flu also has a wide spectrum of illness. Some people only have a very mild illness, where others can get very unwell with it. If we look back in history, we've had lots of flu epidemics, and one of the big ones was in 1918. It's estimated that 25 million people around the world died from the flu. Perhaps as many as 10 to 20% of people who got infected died from the flu that year. Now that was partly because our medical care was nowhere near as good as it is today, and we certainly wouldn't expect that sort of number. But that's why we get worried about flu outbreaks and why we encourage people to get immunised, especially if you're someone who's at increased risk of becoming very unwell if you get the flu virus. The cold virus and influenza are both caught the same way, by other people who are unwell, coughing or sneezing, spreading the virus onto yourself or onto other objects which you then touch your mouth or nose and inoculate yourself with the virus. The key differences in the symptoms is more to do with the onset of the illness. The two illnesses can appear very similar. Influenza appears to be a more rapid onset illness. Mild influenza is very hard to tell apart from the common cold, where severe influenza you're more likely to get the full range of symptoms. So you get the runny nose, sore throat, headache, aches and pains, often get stomach upset, feeling a bit nauseous with it. And it's one that comes on within 24 hours rather than a slower onset. So the most common complication we see from the influenza virus would be pneumonia, where an infection goes down into the lungs and makes you more unwell, affects your breathing, things like that. You can get complications from a common cold. It can still go on and develop pneumonia and other infections, but that's less common than with influenza.